Thank you, Christy, for your topic because it says leadership plays a critical role in shaping the nursing culture within healthcare organizations. As leaders, we work on increasing the workforce pipeline. So, and it's imperative that we retain the nurses that we have. It's as you saw on the generational one, we have a nursing shortage and it's really becoming quite alarming. So please welcome Dr. Christi Nguyen. She's the Associate Chief Nursing Officer. That's a long title. University of Texas Southwestern Medical Center, Dallas, Texas. Is that the one? Door and go left, and it's
Yes.
right there.
Original spot.
Thank you very much for being here.
You're welcome. Thank you. This is fine. This is fine. Thank you. Wait, hold on. Let's see where the thing to advance the slides.
We can't hear you.
Is this it? Green arrow.
Yeah.
This one?
Yeah.
Oh, sorry. Okay.
But
All right. Thank you. All right. Well, thank you so much for having me here. I'm super excited to share some of my leadership journey. I've been in leadership for 21 years, and there's things I've learned along the way. And this ties in, I think, real timely with the workforce, retention, as well as getting people to go into leadership. Because as if you've heard, especially with the manager workforce, a lot of people are getting burnt out and they don't want to be in leadership anymore. So with just a show of hands, how many of y'all are in leadership? How many of y'all are emerging leaders with like 1 to 3 years of leadership experience? Okay. And how many of y'all want to get into leadership? Okay, I see one kind of. Okay. And the one thing I also want to stress is there's a difference between management and leadership. So I also teach in the MSM program for nursing administration, and that's the one thing I teach my students is don't call it management. We don't want to be management. We want to be leaders. We're leading people. Whereas management is just very task oriented. There's not that relationship collaboration that you want with your leaders. Okay. So the objectives are to discuss at least 2 keys to being a successful leader. So like leadership styles to utilize to effectively lead and drive change, and then apply 3 key leadership tactics to transform patient and employee engagement. But some things I'm going to skip over because we heard a lot about EI this morning. And so I was like, oh my gosh, I'm sure you don't want a third talk on that. So, but there's some key things to being successful in leadership. Also, you have to have a vision and communicate that vision with your team so they know, what are we doing? Where are we headed? So that way it helps gets them motivated to want to partake. And it's kind of knowing that why. Communication. I mean, you've heard about communication over the past 2 days. Communication is very, very important. It's also that timing of communication and when, so it's great that we communicate during good times, but what about the bad times? That's even more critical, crucial that you are there to be there to communicate and be face to face with your team. And I learned this during COVID. Usually we're great at communicating, but during COVID and people are starting to work from home, at one facility I worked at, the senior leaders kind of disappeared. And the teams noticed that. The perception is that, why is it that it's okay for me to be here and it's okay for them to work from home? So, it's all about perception. And during those crises, that it's important that you are there with them to talk to them, help guide them. They want you there with them in the trenches with them. And you heard about empathy. Leaders who are empathetic communicate better, listen better, and build that relationship with their team. And they tend to be better leaders. And so I have a whole section on empathetic leadership that emerged really from the COVID and pandemic and crises that's happened. As leaders, you have to be adaptable. You can't come into work, and a lot of leaders know this, with your day planned and this is what I'm going to do, because it never happens that way. So it's very important to be adaptable, flexible, to work with your team. As leaders, you got to make your decision and be confident in your decision. I've been asked, as a leader, how do you make your decisions? And how do you hold yourself and your team accountable? So when you're making decisions, you got to look at what's best for your unit, what's best for the organization. It's not what's best for this employee. Just because you're a compassionate, empathetic leader, it doesn't mean you're a pushover either. You got to look at what's right and do what's right for the team, the department, and your organization. Delegation. It's important as a leader. You can't do it all, and you don't want to do it all. As part of succession planning, when you're delegating, you're also helping build your team's skill set and giving them those experiences and exposures that they may not have when you delegate tasks to them. And one of the key things too, and Asini just told me this 2 weeks ago, someone may not have that experience, but if they got that passion, motivation, and inspiration to want to go into leadership, you can train them to do the rest. So as a leader, you also have to carry that passion, motivation, inspiration, because you lead by example. And you'll hear more about that with the empathetic leadership style. Collaboration, this is like a buzzword, I would say, in leadership nowadays. It's all about relationships and collaboration, because we as nurses, we don't do it all. We can't do it all. It takes you to work with the other team members because you want their perspective, and kind of like what Dr. Bowling was saying. You have to pull in your non-nursing members when you're making decisions or you're putting projects together. And then as leaders, it's all about continuous improvement for yourself and for your patients and teams. So they found that if you combined all 5 components of emotional intelligence with leaderships, you tend to have more effective leaders. And so, that covers the empathy, the communication, which is also your social skills, self-awareness, self-regulation, and there's one more. Motivation. But it's important to combine all that. And if you see, that also kind of tied in with those key successes to leadership. So in a study with over 3,000 leaders by Mincer and Iran, they found that 90% of leaders who had high emotional intelligence were star performers in what they did. So the leaders who had those high emotional quotient or intelligence also rated 30% higher at managing relationships and conflict with their peers. And that's because they tend to listen well and they understood different perspectives. The top rated leaders also understood that with different personality styles and adapting their style, and that's where that generational differences come in, is important. That helps them have that self-awareness to know their strengths and know when they need to reach out to others. People with high emotional intelligence also were able to lead through change confidently. They also help their team challenge transitions by addressing those emotions constructively, as well as maintaining optimism. Because that's as a leader, you're always on stage. You lead by example, and how you behave sets that tone for others. Also, they tend to leave change confidently. They also coach and mentor others better, because as a coach and when you're mentoring, you have that empathy and self-awareness and social skills to provide that meaningful feedback to help others grow. And so with empathetic leadership, and I thought this was really interesting and I wanted to share this with y'all. This study was done in 2021, so during the midst of the pandemic. The global nonprofit group Catalyst found that companies that cultivated empathetic leadership styles found that it was an effective strategy for responding to workplace crises as well as managing their team. They surveyed nearly 900 U.S. employees who are walking across many different industries to understand the impact of empathetic leadership. And so in senior leaders and managers, those who had it saw a 61% higher levels of creativity and 76% in employee engagement versus those who didn't, which was 13% and 32% respectively. And so the CEO of the Catalyst said, empathy is a critical skill to successfully develop a connection and encourage collaboration in hybrid and remote workplaces. And that's what we're dealing with now. Okay. And so like when I came to UT Southwestern and was the ACNO over our practice transition teams, one of the big gaps I noticed is that why is it okay that our educators were teaming our residents? The residents are on the floor working. We should be talking to them face to face, and it was critical to have that face to face interaction as well as having that team support for these residents. And so as we were growing, I noticed, our teams couldn't support the volume of residents and fellows that we had. And that's why we had to sit down and strategically look at our structure to see what will make our teams successful. Because it doesn't help you if you're going to produce, let's say, 150, 300 residents. If you can't get that retention, you can't get them to the skill set, the levels that you need to help them be operational and care for the patients on the floor. So what the study found was, it was a roadmap for senior leaders as well as leaders to help reduce turnover, not for just their staff, but also their leadership team, and to help place their organization to be in a better place to help their employees succeed when there's a pandemic or there's a crisis or anything else that's going on that leaders have to face. And as you know, I know you've all heard about the many different styles of leadership. And there's no one style fits all. Sometimes you have to be situational. Like everyone likes to claim, oh, I'm a transformational leader. Or, oh, they're just saying what you want them to say. You have to actually do it. And so what others have said about me, and this is what I found to be successful through my years of leadership, is that I'm a transformational servant leader. But then I also am a situational leader because that doesn't always apply. Sometimes I have to be that autocratic leader. Or if change is happening and things aren't going the way you need it to go, you have to step in as a leader. You have to know when you need to step in to be that leader. You want to practice afar if you have other leaders working underneath you, so they have that experience to do what they need to do as a leader, but you need to also know when you need to step in to change. All right, so these are the three core things that I have learned through my leadership journey. So I worked for HCA back in 2007 is when I became a director. Everything is profit driven, patients, and it was always patients come first. I worked there for 8 years. And so when I went to Texas Health Dallas, which is a nonprofit organization and the flagship hospital in Dallas, Texas, Dr. Britt Barrett was our CEO. And he and his colleague, Paul Spiegelman, wrote this book called Patients Come Second. I remember thinking, oh my gosh, what? That's against everything we were taught at HCA. But as you read the book, it all made sense. If you take care of your team, your employees, get them the tools, resources they need to do their job, support them, build that relationship with them, collaborate with them, because, you're not the expert in what they do. You got to listen to them, round on them. You will get the outcomes you desire. And that's why patients come second. You take care of your employees first. And that's why when I look at the pillars, people should be first. And so, that's important. Take care of your people, then you'll get that quality metrics that you need. The second thing is what you permit, you promote. And this is very important. So, yesterday they talked about incivility, workplace violence, bullying. You as a leader, if you don't take care of that and you turn that blind eye or you let that one occurrence go by, basically you're telling everyone else, that's fine, I'm okay with it. So it's bottom line is what you permit as a leader, you're promoting. And then last but not least, trust but validate. And this is so important. As leaders, we want to trust that our leaders are doing what you ask them to do, or your staff is doing what you ask them to do. But you as a leader, when your team succeeds, they succeed. When your team fails, it's you. You failed, not the team, because you as a leader didn't step in to take care and do actions. And this is very important because I'll share some of the stories and lessons I've learned along the way. And my last CNO had taught us this: trust, validate. Okay, so now I'm going to share my stories. I've been in leadership for 21 years. I became a director in 2007 at an HCA facility. So most of my leadership training came from HCA because I was there for 8 years. And they do a really great job in training you about productivity, about quality, patients. And that's the year like Quint Studer was really popular. So we got to learn all about Quint Studer's, rounding on patients, the 5 pillars and everything else. So I was happy doing what I was doing. Then my CNO was like, okay, Christi, we want you, because originally it was you're going to be the director of med-surg and oncology services. Then one day she goes, oh, we changed our mind. You're going to be the director of postpartum. And I was thinking, oh my gosh, I'm not a postpartum nurse. The last time I even learned anything about postpartum was 10 years ago in nursing school. All I remember was rub the fundus. And so literally I was panicking. But the one thing I learned with HCA is when you say no, you've just cut your career. And so I'm an optimistic person. I was like, she's not picking me for my postpartum skills because obviously I had none. She's picking me because of my leadership skills. Your leadership skills are transferable. And that's why you have to rely on your team. They're the experts in what they do. And so luckily, I think I've been there probably 3 years or so. So I knew everyone because I was on a bunch of committees and knew the manager and knew the previous director. So it was a little awkward having to step in when she was still there and we both had to work together as a team. But it was good in a way that they see that we supported each other. It was a hard transition for them because this director grew up there. She was a GN, resident nurse, and worked her way up to being a director for like 20 something years. So everyone knew and loved her. So when I came in, key things I looked at was I pulled that last employee survey to see, what issues were they having, then also rounded with the team. And this is critical. If you're a new leader, no matter what organization you go in, people are going to say, what are you going to do? What changes are you going to make in the first 90 days? Well, you should never come flying in making changes. You got to see what's working well, what's not working well, what are the opportunities that you can fix for them. And so I also knew I didn't want to be that leader where people's like, well, who is she? What does she look like? And this was my first time to be a leader over a night shift group. And so I found out when's the best time to round on them. And so I came in on a Friday night and they're like, what are you doing here? I was like, well, you said 11 p.m. was a good time to round. Is it still a good time? Well, like, we didn't think you were going to come. But that was critical. It was years later, someone finally told me, well, we were in a staff meeting. The CNO came and said, Christy wants to be a CNO. So we're going to give her postpartum. And so if I hadn't rounded, if I hadn't, you know, been accountable and followed what I said I was going to do, they would have lost their trust and faith in me. And so that's why it's so important. You have to be there, follow up, be accountable, and then round on your team. And through rounding, I found out that, they felt like their leaders didn't listen to them. They didn't have a voice. None of them had a master's degree or were certified. And in looking at the employee engagement survey, I mean, it was in sync with what they were saying. And so what I did, some of the low hanging fruits was we increased staff meetings. When you've got a team of 60 people, one staff meeting is not going to cut it. You got to make it where the night shift can be there, day shift can be there, did minutes in timely manner so they can read it if they could come. We develop a newsletter. We put together a rewards and recognition committee so that way people felt appreciated. Even a simple thank you makes a difference. And then we also did self-scheduling. I don't need to do everyone's schedule and I don't want to do everyone's schedule. So we let them do the schedules. And then we had 2 people within our UBCs who looked at it, balanced it. And I told them, if you put more people on, I'm just going to move. So y'all take care of it so I don't have to do it. They were empowered and they loved it. They did the schedule. I didn't have to do that. But that all made a difference. And so in doing all these things, that first year, because I had exactly 1 year, we did our next employee survey. We went from being 66% to 88%. And so HCA awarded us with having the most improved employee engagement results that year. So like I said, I was there for 8 years. And then, with HCA, every 2 years, you get a new CNO and you start all over. And so finally, everyone's like, Christy, for you to grow, you need to leave. And I remember thinking, oh my gosh, I've been here my whole career. And it's, was I successful because everyone knew me by that time? And, because if you become friends through work, or is it just luck? But everyone's like, Christy, you got to go. And I started having all these signs from like people at the gym, friends, previous coworkers. I was like, it must be a sign from God. And so, they're like, Dr. Cole Edmondson is like a nationally known leader guru. You need to work for him. And so I guess he reached out to my friend, Sandy McDermott, and she's like, they know you're not looking. They just want to see your resume. I was like, okay, there's no harm in sending your resume. Then I get a call from a director saying, I know you're not looking, but I'd like to meet with you. Let's talk about your goals. What are you doing? So I went to visit and I was totally blown away because we were at Pathways to Excellence Hospital, medium size, went to THR Dallas. And for those who aren't from the Metroplex, they are the flagship hospital in Dallas for THR. So I was really intimidated. I was like that little fish going to this big sea. And so I found when I walked in, it's a culture. I mean, there was so much love, appreciation. I was just like, wow, I didn't realize that was what I was missing at the last place. So that was a real easy sell. You're going to be manager of these two units. Whereas previously, when I was a nursing director, I covered 4 buildings. I worked 60 hours a week, and then to find out I was underpaid. And so that's why, sometimes don't be afraid to take the leap to make a change. And so in coming to this unit, uh, you also had an interview with the CEO. So that's when I met Dr. Britt Barrett. And so he was like, so are you taking main 6 east and west? I was like, no, it's main 5 east and west. Why'd you pick the worst unit? And I was like, oh, I didn't know I was getting the worst unit in the hospital. And so I'm a very optimistic person. And, when you're asked in an interview, it was like, well, when you're down, there's nowhere else to go but up. And he's like, yeah, that's good. That's really good. Because in all honesty, the bar is real low at that point. And so I did the same exact things I did at Medical Center of Arlington, rounded on the team, see what's working well, what's not working well. And then you're going to hear about accreditation later. Second week on the job, Joint Commission was there. They didn't know because I was brand new, hadn't done my orientation yet. I think I literally just finished the hospital orientation. And so I was just moving into my office. No one had my cell numbers. I didn't get an alert. Hey, TJC is here. And hey, they're on your unit. And so that was one moment I thought I was going to die. And so floors could just open up and swallow me. That was the one time. It was so embarrassing. And as a leader, this is why you'll find out later accountability, trust but validate, and always be ready, constant survey ready, because that's the one thing they taught us at HCA. So, Joint Commission came. The charge nurse had her foot propped up on the nurse's station. The ace, walked in with a suit. You would think, hey, someone's walking in a suit. They must be, you hate to say the word, important. You might want to behave. Oh, no. She kept her foot up. They came in with Joint Commission right afterwards. And that's when someone comes running into my office and they're like, Christy, there's like all these people in suits here. I think it might be Joint Commission. I was thinking, oh my God, because I hadn't even learned the layout of the floor yet. So I run out there and introduce myself. This person saw me coming out, put their foot down. I mean, it's like it took them that long. And so when they were asking, well, tell me, how do you know when a physician is accredited? They were just laughing. I mean, they were just thinking it was like a show. They were laughing, and we were a step down unit. We had vent patients as well as med tele. So what do you do with those boxes over there? Well, we do nothing with that. And I was just like, I was like, oh my gosh, I'm gonna die. I was like, you look at it. You don't have a box with little strips and things coming out, and you don't do anything. So let's say it was the worst Joint Commission survey ever. I said, I'm never going to go through that again. And so that's why, as a leader, you never want to go through a survey where you're in that hot seat and everyone's looking at you, because really it's your leadership. And so, in talking to a team, we found out there was bullying going on, incivility. And so, you got to take care of that. And we were known as the dump. Nobody wanted to come to our floors because we were the dump. My supervisor got the doctors even believing we were the dump. And so finally, I told my supervisor, you know what? Let me go around on this one particular patient, because they felt like the house soups always dumped her on us. And, because, all the other floors have great surveys, and, let's just give it to them because their scores are low anyway. So I went around on the patient, introduced myself, talked to her. I was like, I noticed you're always on our floor. I just wanted to know, do you specifically ask for us? Because what else? Why? Why doesn't it make sense? She said, I've been throughout this whole hospital and I love your floors. Your nurses give us the best, or gives me the best care. And I was like, thanked her for that and that we appreciate it. And then we had to talk about respect because she had a potty mouth and didn't always treat the team respectfully. I went back and talked to the supervisor, called the team together and talked to him. I was like, you know what? She comes to our floor. She loves us. I know she has a weird way of showing it, but she loves us. And it's because she says we give the best care. And because of that, and because of me finding that, that changed their attitude. Then they had pride. Oh, she likes us. Oh, that's why they pick us. But that was important because then that started changing things. And then so then I started coming in at 5 a.m. And that's when I'm becoming, it's supposed to be quiet. Why are people yelling in the hallways? That's not appropriate. So we took care of that. And then when that first person who was treating others unkindly and disrespectfully decided to seek joy elsewhere, that changed the culture because they knew she's serious, because if you admit it, you promote it. And so we had, I think, probably 3 people leave shortly thereafter. And some people, you give them the opportunity to change, and some people are able to change. So back to the story of the Joint Commission, there were 2 nurses. I was told, you can't fix them, you need to fire them. Talk about intimidation. You just started, and you're told by your CNO you need to fire some people. You don't even really know them. Well, one of them, I was given a heads up. The supervisors or the charge nurse was a previous supervisor. They're having problems. Well, I had that crucial conversation with her. And so, she apologized, cried. A week later, she made a decision she needed to move on. So that, I hate to say, made my job easier. And then the second person was a young nurse. I mean, she was in the residency program. She just didn't knew better. So we groomed her. I groomed her, talked to her about professionalism, helped help her grow. So she got involved with our unit-based council, started chairing different committees. Even as a resident, she was already working on her clinical ladder points. That way, when she finished that residency, she could submit it. She ended up being my UBC chair. And then a year later, she did so well, she ended up being the chair for the corporate office for THR. So to me, that was amazing how you can impact someone's life. And I know this person's gotten her master's and is now doing another big important role within THR. That's where you as a leader, you need to be able to identify, coach, and help lead your teams. Okay. So things we implemented when I came to Maine for East and West, because we ended up moving to another floor like a couple weeks after I started. I was like, this is the only place I've been to where people don't have a potluck. Where do you do potlucks? They didn't celebrate birthdays, anniversaries, people getting degrees or anything. So I thought, well, that's crazy. Everyone loves to eat and people bond over food. So we implemented a UBC. I had that one nurse help lead it. We did a spirit committee. So that way they would help recognize birthdays and things. We did a formal recognition committee. There was no employee of the month, quarter, or year, which I thought, that's odd. And then we also developed our shared governance so people felt like they had a voice. I had 3 supervisors, and so my supervisors and I met weekly. We made sure that we were on the same page, that they knew what our vision was, and then we were communicating and saying the same message to everyone. We also did the staff meetings. We also created weekly newsletters so that way when people were working and they were off for 4 days, 7 days, they could catch up real quickly. We put the newsletter in key spaces where they could see it. We also emailed it. Through the increased communication, rounding, the formal recognition, and everything, we were able to increase the number of nurses going back to school. We had 0 people participate in a clinical ladder. And I was just like, don't you want free money? I mean, this is stuff you're already doing. Get credit for it. I started posting things up on the walls. People are like, oh, I want my name on the wall. I put people's pictures on the walls so they know who our teams were, who our chairs were for the different committees. And it was real funny because, my office is around the corner. I will see people walking over there taking pictures. But it was pride. They took pride in their unit, and patients walking down the hallway saw that. And they'll be like, oh, that's my nurse. That's my nurse. And the one thing I love that THR did is we gave applause cards. They got $25 if a leader gave them a recognition. Well, it wasn't my money, so I was giving applause cards because that's why you have that money and you have these recognition programs. And so, and like I mentioned, it's not about nursing. It's a team approach. It's that collaboration relationship. And so when EVS came and they, turnover of rooms was hard. If they came flying in doing things, I would say thank you. And same thing with with your materials management, because if you don't get the supplies, your team can't do their jobs, and then who has to run down? My team. And so when you take care of other people, they will step up to do things for more for you. And so I left THR in 2013. I think it was last week. I'm at UT Southwestern, just getting down the elevator. I saw this lady, and she was like, I think that's her. And I was like, who's she talking about? She was talking about me. So she walks up to me. She goes, you were at Texas Health Dallas. She goes, I was your housekeeper. But to me, that was amazing. After all these years, I mean, that's probably 12 years ago, she remembered me. It's because taking interests in the team, rewarding and recognizing them. So people knew when you go to Christy's team, she's going to recognize you and thank you for doing a job well done. And so our unit, our employee engagement scores soared. So this is the slide where I was like, I have to have my data because I can't read that. So in 2012, when I started there, we were 67.7%. I had 4.5 months to turn that around because our employee survey was in May. When I was at Medical Center of Arlington, I had a year to get it from 66 to 80. I was like, oh my gosh, I can't do that. And if you think about that 4.5 months, part of that was my orientation. Well, we went from 67.7% to 74.5%, which is pretty cool. A year later, when we did our survey, we went up to 92%. And so that year, they also changed how we did our surveys. They started giving us this raw number. I can't remember what it's called. So it was like a 4.63. The year after that, and this is where it's important, what you permit, you promote. They found out our supervisor was sleeping with one of the nurses, tore the team apart. It caused issues. We had issues. Then I got blamed for it. We had to do a lot of investigation. It was a really difficult time. What I learned from that is during these moments when times are tough, you still got to show up. Even though it's hard and you want to hide, you still got to show up. You still got to talk to your team and do what's right. And so that person ended up leaving. And then we were able to bring our scores back up because we addressed the issues. We supported the nurses because there was lack of trust. Because it's like, well, what have you been telling your boyfriend? And so there's lack of trust amongst the nursing team and friendships got broken. And so that year we did have a little dip, but in my eyes, considering all the things we went through, it wasn't that bad. We dipped down to 89%. Our raw score was 4.46. And then the year after that, when we fixed it, our raw score went up to 4.59. So then let's talk about what if you got a good unit already that's not struggling, that's not the worst unit in the hospital. So Main 4 East was a happy unit. So that I would say they're above average. So when I started there, it was 72.9%. In that short 4.5 time, we got it up to 83.2%. A year later, we got that up to 90. And then when I left, it was 97%, which is totally amazing. Made me super happy because it means your team's happy. You're doing your job. And to me, it meant the world when one of my colleagues told me, I want your units. I will take care of them and leave them good because you left them good and you fixed it for us. And so that made me super happy that the work will continue. When you look at job engagement, this was huge. It went from 49.5% to 64.9%. And so in terms of patient care and quality indicators, we improved in all our scores. So in summary, for that one hospital, I used transformational leadership and engaging employees in their work and career goals. It wasn't until after I left that some other folks told me, you're a huge servant leader. And that's when I became known as a transformational servant leader as well as visionary, because I'm able to see ahead to see what we need to do to be proactive and then lead the team. But the key thing is leaders need to stay engaged, maintain relationships with their team, and explore additional ways to implement transformational leadership. And I only have like 5 minutes left. So keys to success. So then I became the executive director at a large safety net hospital in Fort Worth. And so it was the same exact things. I'll notice, everywhere I go, there seems to be a problem. And so I was over 9 units for the medical surgical services. It was 307 FTEs, 172 beds with a $61 million operating budget for med-surg. So in 2016, our employee engagement score was 4.46, and we increased it to 4.87 a year later. Our BSN rates in 2016 was 58.5%. We increased it to 77% in 2022. Certification rates, 4.87%. That's really, really low. So in 2021 and 2022, we brought that up to 25%. And so I've been told, for a med-surg unit to have 25% certification, that's really high. Because if you think about it, a lot of your nurses who go into med-surg, if they grow and advance, unless they love med-surg and stay in med-surg, they end up going to ICU, ER, OR. And so as soon as they get their master's certification, they're gone. For us to maintain 25% during that time, that's pretty significant. 33% of my managers were master's prepared. When I left, 100% of them got their masters. So that was really cool. But it was the same exact things. You got to be around, be visible, communicate with your team, do quarterly appreciation. And we dressed up, we did funny things, but we showed love and appreciation to our team. And that was really critical because during COVID, our um, engagement went down. And so I remember it was like late January, and I told my admin coordinator, I was like, because I mean, I'd go back to my office and want to cry because, everyone, because you see your team hurting. What can you do for them? I mean, you're already rounding on them. So I was like, Valentine's coming up. Let's do love and appreciation. We ended up they love coffee bars. We were the baristas. We bought 4 Keurigs and we dressed up with our little hats and we made them coffees, like whatever they wanted with the specialty, you know, um, things you add in. And my admin person made little bags of candy with words of encouragement on the cups, and they appreciate it. So even though our employee engagements and turnover that year decreased, because our turnover was like 11%, 12%, it did decrease to 20. I mean, it increased to 20% in turnover. I remember thinking, oh my gosh, what did I do? But then when you look at the national average, that was really good because people were leaving to go to the travel nursing and things like that. But then also the thing that people said, remember, is that they wanted to see their leaders. They wanted you to communicate with them and be visible with them. Other things we did, like during crisis, is like during ice storm days, it was critical that we were present. And so I always made sure that some of my managers could be there. I was there. But when they see that you as a leader step in to help, they know that you're going to not ask them to do something they did. So like my managers and I, we'd wake up at 5 o'clock, help fold linens, because if no one's there folding linens, who's suffering? Our patients. They had people calling in because people in the dietary services couldn't get to work. So my team came in and we helped them prepare meals, and they appreciated that. Okay. Besides the people pillar, obviously as a leader, there's other things you got to focus on: your quality metrics, your financials, as well as accreditation. So as a leader, you're accountable for your quality outcomes. But remember, if you take care of your people, they will step up and do the things you need and do the right things. And so you got to look at the most common ones are CLABSI, CAUTI, falls with injuries, and any other key performance indicators within your area. And use your team. Use your super users, engage them, because that's also helping them grow. Other things we did is we use quality tools to help us in this. And so we did a PCA, because I also manage wound clinics, on wait time. That was our huge dissatisfier. And so the team got involved. We did PCA. We improved it. It didn't work. We would do something else to see what else can we do to fix improve time. We also did our Lean Six Sigma belt. When I was at Texas Health Dallas, I got a supervisor. We pulled the core team in because remember, you can't do it all. Key players included our PCTs, our EVS, as well as material supplies, and then the nurses. And we looked at, where can we save and what can we do to help? And it turned out people didn't realize every time you took something, you're like, I don't want this, you got charged for it. Or something like, let's say the linen was dirty, there's holes in it. If you put it back in the bag, you get reimbursed for it. We were able to save close to $7,000 on that project, and we ended up receiving the Financial Sustainability Award from our Operational and Clinical Excellence team with a 9% cost saving, and it was something they were able to implement system-wide for within THR. At JPS, the other hospital I worked at, we did a Lean Six Sigma green belt on falls. And so I had a team of people, and we included EVS because, they're the ones moving things around our room, and they were not aware of your patient's fall risk. Patients, because who would thought to involve a patient in your process improvement? But we developed something called TIPS, where you individualize patient preventions for the patient. So we wanted their input. Hey, does this work for you? How should we place this? And does this make sense? It was a communication tool for them as well as their families, and then pulled in the nurses and the techs. And we were able to significantly reduce our falls and falls with injuries. Because, by the end of the day, you don't want your patients having any harm. We're there to help take care of our patients. Accreditations, this is your responsibility. So my VP of quality and accreditation at HCA instilled in us, you always have to be constant survey ready, because kind of like I shared when I became the new leader at that one hospital, you never want to go through that as a leader. So when I joined JPS, our CNO said their last survey was bad. She was in the hot seat with the board to talk about their fallouts. And so I put together some pocket guides, because at HCA we had pocket guides. Did the same thing when I was at THR, and then brought it to JPS, and that ended up going system wide. But we also had weekly, monthly tips to keep people ready. We also did mock surveys. With my managers and I, we would walk the floors and pretend we were Joint Commission and ask them so they would be prepared. And also, we also had taught people, phone a friend. You don't, when you're working in nursing, you're not the only one there. You may reach over to friends. Remember, you can phone a friend, chime in to help each other out. So, besides that one survey, I've always had successful surveys where we got our accreditations and even distinction. So when we opened up a brand new wound care clinic, we built it with the end in mind of becoming a Joint Commission accredited, and we got distinction. And then at UT Southwestern, we also got accredited again on our second redesignation with distinction. And that's through working with your team, making sure your team's involved, engaged, know what's going on, prep them to get them ready. So there's many different types of accreditations. I just listed a few: the Joint Commission, Magnet, Pathways to Excellence, and the disease-specific accreditations. In summary, you also got to take care of yourself as a leader, because we talked about growing, mentoring. You make sure you have a mentor, but also make sure you're mentoring others, because when you're mentoring others, you're going to learn new things, or you're going to get refreshed on new things or old things that you may have forgotten. Networking is so important. It's like they say, it's not always what you know, it's also who you know. And so it's important to build those relationships. So I do a lot of mentoring also with ACHE. And like, I just spoke to a new mentee the other night, and I told her, the power of networking. Get to know the person, build relationships before you start asking them about jobs or connecting them with other key people. Be active in your professional organizations, because you're going to gain skills that you may not get at work. And so I had a long roundabout way to becoming a leader. I didn't get a mentor until 10 years into nursing. And my first mentor was my COO, who was not a nurse. He was the one that pushed me to go get my fellow in the American College of Healthcare Executives. But through that, being active in ACHE and then mentoring, that's helped me. I got encouraged to, be the president of the North Central Organization for Nursing Leadership. And being brave and taking on that, I was able to get involved with the DFW Great 100 board. So now I'm the president-elect for that. And then I'm also the AONO Board Region 7 representative. But it's all through mentoring that they told me, you can do this, because you're going to get skills that you don't normally develop. And through being involved in all this, that's how I ended up meeting Dr. Hernandez at Victoria, England, who was the previous ACNO and our chief nurse executive. If I hadn't been working in all these different professional organizations, interacting with them, working on projects, I probably wouldn't be where I am today. So that's why, be active. Don't just join to be a member, because for me personally, nothing irks me more when people say, I'm a member of this, or I'm on the board, but what did you do? And so a lot of people nowadays, when you're interviewing, they don't want to know that you're just on the board. What did you accomplish in that role? Okay. And then say yes. When people ask you to do things, don't be afraid to say yes, to take on the new things. They wouldn't ask you unless they believed in you and knew that you can do it. Okay. And I think that's all I have. And then these are my references. Any questions?